Hypnosis isn't mind control or lots of other things. Hi, I'm Dave Ruby from Workable Hypnosis, and this video is actually about what hypnosis isn't. I did a video a while back on what hypnosis is. This is kind of these are kind of some of the things that it's not. And credit to Jeff Hicks, another great hypnotist and coach, for the idea, because he mentioned a David Kaloff audio that mentioned things that hypnosis isn't. They were useful distinctions, so you can kind of see what it doesn't. So a few things that hypnosis aren't. First, that's kind of a misconception is that hypnosis isn't sleep. Hypnosis love to say sleep. And I think there's a historical reason behind that, but when you are in hypnosis or doing hypnosis, you're not really asleep. Often it's described as being like a daydream, but really it's more just a state of focus and absorption. But if you are in hypnosis and you actually fall asleep, you've left hypnosis and gone somewhere else. However, if you're in hypnosis, you may find it's very relaxing. And one of the ways to tell is that if people do hypnosis, they often come out of trance, so to speak, or they wake up exactly when the hypnotist says so. So there are people that go so deep that it feels like sleep. Another of my favorites is hypnosis is not a special state. There are actually a few models of hypnosis. Really, there are people that view hypnosis as a state-based, you get into a trance. That's one model. The other is hypnosis is a process, it's something you do. Actually, there's a book coming out by James Malvin Harrison on hypnosis. I'm blank on the title, but it's a great look at that. It talks about different states and the science. But hypnosis is not a special state. From my understanding, when people have been put on an MRI and done brain scans while they're doing hypnosis or in hypnosis, however you want to put it, there's nothing unique about how their brain works. There's a difference, but there's nothing that seems like it's a unique state or a unique brainwave signature for hypnosis. It seems to be based on how we naturally do things. We naturally go into and out of trances, but it's not unique. There's nothing you can look at and go, that's hypnosis. One of my favorites, and probably one of the more common ones, hypnosis is not mind control. You do have full control of what you say and what you do. Now there are some caveats to that. So there are things your unconscious mind can give you the sense of having hypnosis being done to you. But if there's something you find you're morally opposed to, or you just don't want to do, essentially you won't do it. And my proof for this is I never found anyone to disprove this. I would love to find someone if you could. If you can make someone do anything you want to, then you can go to a prison or a mental hospital and hypnotize someone to stop doing things that are ruining their lives. You'd make more money than you could count, and you'd be a hero to millions. However, there's a lot you can do. You just can't make people do anything against their will. And if something's really embarrassing or if something is against your moral code, essentially you can't do it. The other caveat is you can trick or manipulate people. Don't. But you can. You can do that with or without hypnosis. You can use authority. You can use your power over someone. You could trick someone or make them uncomfortable, and they might do things they otherwise wouldn't want to do. I would advocate not doing that, but it's possible. And that can be done with or without hypnosis or trance. Hypnosis is not forever. You cannot get stuck in trance. So there were concerns back in the old days, and probably now too, that what if I can't wake up from it? No one has ever gone into hypnosis and not come out of it, or failed to come out if they didn't want to. The if they didn't want to part is because there's something called the Esdale state, where I'm not sure it's an actual state, but it essentially gets someone into a really deep, profound state, and it feels really good. You're very relaxed. You feel good. I think there are probably endorphins going through the system. It's very pleasant. And some people choose not to come out for a while. Eventually, you'd have to go to the bathroom, and that tends to work pretty well. And if you do come out, when you come out, it may take a little time to reorientate. The other way that some hypnotists have got people out is to start charging by the minute. So if they go past the time for the session, then you can say, I'll have to charge you, however much per minute you go into the session. If you charge $100 a minute, they come out in New York second. but it's not something that's permanent. No one's ever gotten stuck in hypnosis forever. The other one that I've heard is that some people can be oppositionally defiant. So if you tell them, and you'll come out as I count to 3, you still have the authority to say, no, I'm going to stick around and just kind of hang out in trance. But again, no one's been stuck there. There is control over your own experience and how quickly you want to come out of trance. Hypnosis won't cure diseases. It's not the panacea for all of life's ails. This is one that came up, actually. I've heard it. I heard it when COVID came out. People were trying to say that you could cure COVID with hypnosis, which you can't. And people have said that you can cure cancer, which again, show me the evidence. Now, there is one slight caveat. Even though you can't cure diseases, it has been used in medical applications, notably for pain management, anxiety, and depression as an adjunct usually. There are also some cases, unconfirmed, but that it's been linked to, like, some people said that people have seen them and they had remission from cancer, which is a bold claim, and I've never seen clinical evidence of that. I would point out that that can happen with or without hypnosis. There are people that go into spontaneous regression. I think it's irresponsible to say that hypnosis cures cancer because it seems to not be true. If it was, then if you're a hypnotist, there are probably people you've known in the field who have passed away from cancer and it didn't work. So, but it doesn't cure diseases, but it has been used in conjunction with other medical treatments. And if you get someone into a nice deep hypnotic trance state, it seems feasible that that could help their system work better against illness. That's not the same as saying it can cure disease. As far as all the evidence I've seen indicates, it can't, unfortunately. Hypnosis is not magic. Hypnosis is an evidence-based practice. There's science on how it works and what it does, but it will not regrow limbs or organs. It will not make you or turn you into Bruce Lee or teach you how to fly an airplane. It will not make you tell the future. So there are limitations to what it can and can't do. It's an amazing modality. However, it's not magic. But I want to thank Jeff for the prompt. If you have any questions, comments, disagree, feel free to leave those in the comments. If you have anything else you'd like me to talk about, I'll leave those in the comments or send me an email at david@workwellhypnosis.com. Until next time, thanks. Have a good one.